In a spirited effort to promote healthier lifestyles among St. Lucians, the Ministry of Health, Wellness and Elderly Affairs, in collaboration with the Capacity Building Project for the Prevention and Control of Metabolic Diseases in St. Lucia, hosted the Healthy Eating for Better Living event on Friday, April 25th at the Saltibus Wellness Centre. The one-day initiative, held under the banner of health education and disease prevention, featured an opening ceremony that brought together specially invited guests, health professionals, and ministry officials. In attendance were key stakeholders committed to tackling the growing burden of metabolic diseases through informed nutrition and community engagement. The highlight of the event was an interactive cooking session that offered participants hands-on guidance in preparing nutritious meals using locally available ingredients. Health experts shared practical tips on balanced meal planning, portion control, and the importance of reducing processed foods, salt, and sugar in everyday diets. Nutritionist for Region 5, Fadia Campbell, explained the significance of the activity and its role in reducing the risk of metabolic diseases.
So the activity here today, it represents a practical demonstration of healthy diet for individuals who may or may not have chronic non-communicable diseases. And the goal here is really to encourage or to continue to encourage you to eat the locally grown foods. C'est manger ou ka planter un saltibus, right? C'est go manger ou sa servi yo, but of course ou ni pou servi yo at a limit. All right? So we know that lifestyle modifications, especially dietary habits, are the main therapeutic strategy for the treatment and management of what we call metabolic diseases.
During her address, the Senior Medical Officer for Non-Communicable Diseases, Dr. Shanna Sear-Filbert, emphasized the critical role of healthy eating in the prevention and control of chronic diseases, noting that small dietary changes can lead to significant improvements in overall health outcomes.
There is strong evidence that links the impact of diet, what we eat, on not just our physical health, but also on our mental health. So, you ask yourself, and I ask myself as well, do we have the power to eat ourselves to health or death? While you're answering, I will say, yes, we do. We have the power to decide what goes into our mouths and what affects our health and our life. There is an overwhelming body of evidence to support the role of diet in causing or preventing diseases. So we're saying that there's evidence that shows that what we eat affects us for good or not so good. Mrs. Campbell mentioned this earlier, so you're hearing it again because it is extremely important. A diet that is high in saturated fats, trans fats, high in salt, and low in fiber, and we know we get our fiber from our fruits and our vegetables, it contributes significantly to heart attacks and strokes. And in case you did not know this, in Saint Lucia, for the past 20 years at least, strokes and heart attacks are the leading causes of death.
Participants were engaged and energized, leaving the event better equipped to make healthier choices at home and in their communities. The initiative forms part of the ministry's ongoing public education campaign to reduce the incidence of lifestyle-related conditions such as type 2 diabetes, hypertension, and obesity. The Ministry of Health, Wellness and Elderly Affairs continues to advocate for healthier communities through collaborative efforts, educational outreach, and sustainable programs that empower citizens to take charge of their health. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Onika McCoy.